Thank you. My name is Paddy Caffrey. I'm a board member of the Bunscore Health System, and it's my privilege to chair the final session of the day today. I've had three very interesting sessions up to now, sessions looking at partnerships, patient experience, and planning how to do the right thing in the future. And this session, I hope, will give us, with our speakers, some insights into the tools and the mechanics, the methodologies of how we might achieve the objectives of the conference, which are patient experience, developing partnerships, and planning for the future. Our first speaker, Professor Cathal Kelly, took up is in fact the Chief Executive and Registrar at the Royal College of Surgeons in Dublin. He's a graduate and a fellow of RCSI. He previously held the post of Dean and Dean of the Faculty of Medicine and Health Science, and prior to that was Consultant General and Vascular Surgeon in Beaumont Hospital. Apart from, and in addition to his medical education, he was clearly very interested in the business and went on to do a diploma in medical education at Queen's University Belfast, an MBA in the Institute Impresa in Madrid, and a 6-week program at Stanford Graduate University. So I'd like to welcome to the stage Professor Cathal Kelly. Thank you.
Thank you very much, Chairman, and sorry to bring everybody back from their coffee so quickly. Firstly, can I start by thanking the Bunscore Health System, Chairman Peter Lacey and CEO Bill Maher, for inviting me to participate in this conference, and indeed congratulate them on the conference. I think we've all really enjoyed it, and it's funny, reflecting on the last few talks, we often talk to our medical students about this, probably closely linked to the theme of professionalism. It really is such the theme for today are all the P's, patients, partners, etc. And I'm to talk about professionalism, but the one P that overwhelmingly comes to me right now is privilege. When we hear the previous speakers, and we do say this to our students and to all our staff, it is an extraordinary privilege for all of us to be allowed to walk part of the journey with such extraordinary people and share in their life stories. And I'm very grateful for them for their presentations. I'm going to talk a little bit about RCSI and the background and why we're so interested in professionalism and participating in conferences like this and engaging in this manner. I'd like to describe professionalism as we see it, talk about how we try to address the challenge of teaching professionalism, assessing it, its impact, and then perhaps most important of all, the real impact of professionalism as far as I can see is to radically change the culture, or its impact, or its linked to the culture of work in the health service. By a little bit of background, RCSI, we were founded in 1784. Like the Bonds Group, we're a not-for-profit. We're an independent health sciences institution. We have schools of healthcare management, pharmacy, physio, medicine, postgraduate studies, faculties, etc. We're headquartered in Dublin. We have about 1,300 full-time staff in Dublin, and then our clinical partners. We run a university in Bahrain, a school of healthcare management in Dubai, and 2 medical schools in Malaysia. And also in the COSEXA region of sub-Saharan Africa, which is 14 countries, headquartered in Arusha, we, with Irish Aid, are the largest Western provider of surgical training in that region, using our online resources, and we've established about 26 ICT labs in that region. What's unique about us, and I think empowers our activity, is firstly, we're completely focused on healthcare and healthcare research. We've no other interests. Secondly, we're by definition international and multicultural. And as we heard the American ambassador speak this morning, if you're a GP in London, 60% of your patients weren't born in the UK, and I'm sure Ireland's not far behind. But also quite uniquely, we are a combination of a university institution plus a postgraduate training body. So we look after healthcare professionals through the entire continuum of their practice, from undergraduate student to postgraduate trainee to consultant or other healthcare professional undergoing continuous professional development, which I think gives us a unique insight and indeed a unique responsibility. Professionalism, to move on to it, it's over 100 years ago, George Bernard Shaw described professionalism as a conspiracy against the laity. And I'd hopefully like to move on from that. And because of time pressures, I'm going to focus on the medical profession. But our philosophy at RCSI and many others is what I say about professionalism applies to all healthcare professions and indeed healthcare managers. And at RCSI, because we have a range of professions, all our thinking, all the way we apply professionalism, we apply to all our courses. In 2005, mindful of the radical changes in society and the pressure that medicine was under as to what was our place in society, the Royal College of Physicians in London undertook a piece of work called Doctor in Society. And out of that came, I think, a very good and workable definition of professionalism. Medical professionalism signifies a set of values, behaviours and relationships that underpins the trust the public has in doctors. To refine that further, professional competence is the habitual and judicious use of communication, knowledge, technical skills, clinical reasoning, emotions, values and reflection in daily practice for the benefit of the individual and the community being served. Elliot Friedson, in his wonderful book, The Profession of Medicine, describes a professional group as a group which reserves the right to judge its own work based on three societal assumptions: an assumption of expertise, an assumption of altruism, patient comes first, and an assumption of self-scrutiny. And in some ways, this leads to the classic model of professionalism, which still is in the public's imagination to some degree, and indeed in the imagination of some of our colleagues. The doctor as this all-knowing, all-wise, always available individual who is in charge of the situation. There's no sense of partnership with the patient in a diagram like that. Now, I think we're all uncomfortable with that model of medical professionalism and doesn't fit into the modern context, as indeed we've repeatedly heard today. And professionalism certainly is not a fixed concept. It's molded by our culture, by context, and it's generational. And there are a lot of new forces in healthcare, some of which we've heard. They're putting a lot of pressure on that model of professionalism, indeed perhaps rightly so. There's democracy of information. No longer does the doctor or the expert in anything control information. There have been some spectacular failures of the professions to meet their obligation. In the age of science, it is challenging to explain risk and uncertainty to patients where science hits the reality of clinical practice. We live in an environment of an excessive political and media knee-jerk response, the need to respond immediately based on not all the facts, not all the contexts. That oftentimes leads to inappropriate regulation and overreaction. The professionals themselves are not prepared to be available all the time. There is a requirement for a family-friendly, balanced lifestyle. We live in a consumer ethos, and there is a drive for more and more regulation. Dame Janet Smith, who led the inquiry into the Bristol baby's cardiac problem, the Shipman inquiry, I should say, and also more recently led the Savile inquiry at the BBC, said at the root of professionalism is trust. And trust operates at two levels. Individual professionalism is trust in the individual doctor or healthcare professional providing care. Institutional professionalism refers to trust in the system where the care is given. Both need to be working hand in hand. There are some aspects of professionalism which I feel can't change, shouldn't change. A commitment to competence, to a code of ethics, to integrity, honesty, trust, and altruism, and a sense of vocation. However, areas that are changing, and indeed must change, are a move from internal self-regulation to accountability and openness, from mastery of knowledge and skills to a commitment to continuous development and learning, from paternalism to partnership, and some would even feel that's not far enough, from tribalism to collegiality, and from self-sacrifice, or a requirement for self-sacrifice, to shared responsibility. The roots of professional behaviours are rooted in an individual's values and code of behavior, or mode of behaviour. And in some ways, it should not have come as much a surprise to us as educationalists, but it was when work by Marianne Papadakis and colleagues looking at medical students over a 10-year period in the University of California, San Francisco system, they found that there was evidence, students who had evidence of some unprofessional behavior during their period as medical students were twice as likely to end up in front of the licensing authority in California. Furthermore, medical residents who had some issues about their professionalism flagged during their training were also highly likely to end up in front of their state licensing authority. This shouldn't have come as a surprise, but it was a real wake-up call for educators. For educators, the challenge is in terms of admission to the profession, in terms of setting role models for behaviours, teaching and assessing behaviour, targeted interventions, and how to counsel people who are patently unsuitable for the profession into another vocational route. At RCSI, our mission is to educate, nurture, and discover for the benefit of human health. We're in the middle of an investment programme highlighting our strategic priorities. Our number one priority is education, and a key part of that is education in professionalism. We're focusing on it right through the continuum, undergraduate students, postgraduate training, to the continuous professional development that our consultants and healthcare professionals undergo as part of their registration requirements. Professor Kieran Murphy is our Professor of Psychiatry. He's a former President of the Irish Medical Council. He's been appointed as the first Vice Dean for Professionalism in any Irish medical school, looking at after aspects of professionalism throughout all our undergraduate schools, heavily influenced by colleagues such as Dr. Michael Brennan, who's been hugely influential in our thinking in this area. Kieran and his colleagues have worked to define medical professionalism for RCSI and to look hard at how we assess it and how we deliver it right through our curriculum. In some ways, it's a story of progressive transformation of somebody from a post-leaving cert student into a qualified professional either 5 or 6 years later. It's a transformative experience, and one of the first set pieces in this is an event that we called our white coat ceremony, where our undergraduates in medicine, pharmacy, physio, nursing stand together and take an oath that reflects what are appropriate professional responsibilities for them at this stage as they embark on dealing with their first patient, who we define as the anatomy cadaver that they deal with in the anatomy lab. That they understand what a privilege it is, what an act of generosity it is for that patient or person to have donated their body, and indeed their families to participate in that, and the level of professional behaviour that we expect for them in that environment. And that's gradually built as they work their way through the programme. Now, this is a busy slide. It's a deliberately busy slide because we have a very busy programme. But what it shows you is how this is a vertically integrated process right through every subject. This is psychiatry, and in this column we define the outcomes. Sorry, I'm pointing to myself. We define the outcomes, the professional outcomes that we expect to deliver in the psychiatry program, in what part of the clerkship or program they're delivered, the marks attributed to them, and how they're assessed. For every subject throughout the undergraduate curriculum, we have a similar process in place to gradually form the appropriate professional when they graduate. Professor Oscar Traynor is our Professor of Postgraduate Surgical Education. He and his colleagues are in charge of postgraduate training at RCSI and are committed to integrating professionalism into postgraduate surgical training in Ireland. Depending on what audience you address, if I was addressing medical educationists, I'd be in true fear of mentioning the word apprenticeship because it seems to come in and come out of fashion. But the truth of the matter is, from the time of William Halstead, where postgraduate training was first formulated, apprenticeship, defined by repeated practice over long hours with a strong relationship with a trainer or role model, is a key part of postgraduate education. We've, under the leadership of our former president and board member of the Bonds, Professor Paddy Brough, addressed some serious issues in surgical training in Ireland. It was clear that the training had to be shortened, had to be much more family-friendly, and had to be consistent with the European Working Time Directive. And they moved mountains to make that change and have been very successful in that. In doing that, we knew that there were going to be problems with this as we attempt to get people ready for independent solo consultant practice. An inevitable decrease in operative experience and a decrease in that role model effect with a possible impact on professionalism training. To address this, Oscar and colleagues have developed a human factors training program which was a first in the world, in fact, and has been replicated right around the world in residency programs, focusing on human factors issues, initially using the model of the airline industry, crew resource management, but gradually bringing in more and more elements of professionalism into that program so that it's taught off-site, teamwork, realistic simulations, regular assessments, and regular reinforcements. This is an example of one module, relationship with colleagues. And certainly we will emphasize respect, collegiality, and professional loyalty, but not ever at the expense of raising concerns, whistleblowing, and misplaced sense of collegiality. And that's just one module in a human factors course that is delivered in a built-up manner throughout the postgraduate training of this surgical trainee. In addition, we have developed online learning resources, including resources around professionalism, to work on blended learning, bearing in mind that our trainees are in full-time employment in the HSE and other places. The one truism of education is that assessment drives learning. If you don't examine it, it will not happen. And again, this is a marking sheet from a postgraduate surgical exam where you can see that we look at professionalism and professional capability and bedside manner every bit as much as we're interested in knowledge and skills to reinforce the importance of this to our trainees. Professor Sean Tierney is our Dean of Professional Development and Practice at RCSI, who's very involved in continuous professional development for our consultants. And again, many of the issues that do come to the attention of medical councils and other regulatory bodies happen in independent clinical practice. This is a key area of focus for us. We have a series of master classes on human factors, medical professionalism issues. But assessment of it is really difficult. In many professions, it's portfolio, it's self-assessment, but in truth, the people who have the most to learn are frequently those with the least insight, so it's challenging. We happen to believe that maybe the future for organizations, and can only happen with the support of the employers and organizations, is multi-source feedback. The Irish Medical Council has run 3 trials in this with volunteers. We have participated in surgical research demonstrating that multi-source feedback is feasible, reliable, and a valid method to assess practice, particularly non-technical competencies such as communication and interpersonal skills, and would be strong advocates for that. So what is the impact of all this? Yes, it is nice to be nice, but it's more important than that. I think it's important to the profession itself, because I would put it to you that you cannot function as an effective healthcare professional without trust, and trust is built on your professionalism. I think it's important to society because no amount of economic incentives, technology, or administrative control has ever proven to be more effective surrogate for commitment to work than a commitment to integrity and the ideals of professionalism. And sometimes, if you look at the extremes of unprofessional behaviour, you see the value and the importance of it. And frequently, one doesn't see extremes such as this. It's frequently a pattern that's built up over time, unchecked, of incrementally unprofessional behaviour, mitigated or allowed by a non-responsive management system. And this does hit everyone. Patients hits the bottom line. It creates a poor work environment, poor communication, poor handovers, lack of trust, high staff turnover, reduced patient safety, loss of finances and reputation, and increased liability and risk. And as we've heard, it's not all about money, liability, and risk, but a lack of professionalism would only impact on the patient experience. Not only will it impact on patient outcomes, it will also very much impact on the bottom line. And I think at the heart of this is culture. We've heard repeatedly today that our current model of healthcare is unaffordable. It just can't keep rising in cost out of kilter with rises in the GDP. This is an interesting slide. It's a busy slide. McKinsey's looked at productivity as a measure of disruptive technology. And you can see in every industry, apart from these 2 outliers, there's been evidence of increased productivity, increased disruption. The 2 outliers are education and healthcare. In fact, there was a 3rd outlier, it was mining industry, but I thought I'd leave that one out. So you can see that in education and health, we're on the cusp of major change. And we at RCSI want to very much play our part in that. As we've heard many times, you can have a strategy, you can have tactics, but in the end of the day, it's all about culture. Culture is what goes on when no one's looking. And the culture of your organization will very much determine its, if you like, activity. And I'm going to really end, or very shortly end, by this commentary by Don Berwick, who's well known to all of you as head of the Institute for Healthcare Improvement, in a very moving tribute to his father. When he was awarded an honorary fellowship by the Royal College of General Practitioners in London, he paid tribute to his father, who epitomized the classic vision of professionalism, a solo practitioner selflessly in a small town in the United States. And while paying tribute to his father, he recognized that that was not fit for purpose for the future, that we were either destined to grieve for the passing of an age or embrace these changes, to reconsider our sense of professionalism, to rise to today's challenges. I don't want to read it all, but we need to embrace citizenship in the greater whole of healthcare rather than focusing on our solo relationship with the patient. We need the skills to play a part in that membership role. He likens it to being the effectiveness of two good parents instead of working on the skills of being one great artist. And then, perhaps to go down to the very end, the aim is to promise every single patient the benefit of the best care at the expense of the autonomy of the individual physician. And I think that is an important concept as we reset and reimagine professionalism. At RCSI, in truth, by that concept, we and the other higher education institutions are probably guilty in the past of unprofessionalism, because we've worked in glorious isolation in parallel with the health service, often sharing the same sites, same staff, but working with little recognition of each other's challenges. We want to change that. We want to use our core educational programs to address the real healthcare needs. We want to analyse what's going on in healthcare and have established a healthcare outcomes research centre to that effect. And we want to help healthcare managers improve the processes by establishing a process improvement unit. I'm not going to tell the Bon Secours about your mission or your values. My part in your 1-6-20 strategic plan, as I am one of the 1 in 6 consultants who had the privilege to work at the Bon Secours. And I can attest to the fact that your environment and your staff do work your mission every day. And I know you are very proud of them, and rightly so. We at RCSI are very proud to be associated with the Bonds. We share a lot of similarities. We're independent, we're flexible, we're fast-moving, and we're not-for-profit. And I think we share a vision that is rooted in excellence in patient care. Our first tangible collaboration is a chair in medical professionalism. We think that's very, very important to drive cultural changes in both our institutions. So I'll end by saying professionalism is a challenge and a mandate for us, the medical educators. Values and culture lead to our behaviours, and the implementation of cultural change through a focus on professionalism is certainly my goal. I'd like to thank you very much for your attention.